Welcome to the Safety and Risk Success podcast with me, Christian Harris. Stanley May was 74 years old when he walked into his local co-op store in Truro for his weekly shop. It was July 2015, and all he wanted to do was pick up a few essentials. But water had been leaking from a broken sandwich chiller for almost 44 hours. There was a yellow wet floor sign out, clearly visible, but the sign didn't stop what was tragically to happen. Mr. May slipped, banged his head, and died 2 days later from a subdural hematoma. The co-op was fined £400,000 by Cornwall Council, but here's what really gets me. This wasn't an accident. It was completely preventable. And Stanley's story isn't unique. It's happening every single day across the UK. Not to that severity, but people are slipping every single day. And the only difference is that because it's a bit less severe, most slip incidents don't make the headlines. So that's why we need to talk about something that affects every single person listening to this podcast, slip safety, the danger hiding in plain sight under our feet. So then today on the podcast, I'm going to talk to you about a special campaign I'm running this month, how you can get involved, and how you can get some freebies too. So do listen on.
Welcome to the Safety and Risk Success podcast with Christian Harris. We believe that proactive safety and risk management powers business performance. Each week we explore this theme, sharing guests, stories, insights, trends, hints and tips. You can find us on all the major podcasting platforms, and video versions are available on YouTube. But for now, let's join the conversation with Christian.
Welcome to the launch of Sliptember, a month-long campaign to raise awareness about the proven scientific method to prevent slip accidents. Now, you might be thinking, really? Another awareness campaign? But here's the thing, whilst everyone knows about Movember and men's health, hardly anyone talks seriously about slip safety. Yet, slips are the biggest cause of accidents, injuries and claims in the UK. I started Sliptember for the same reason that Movember exists, to shine a light on a serious issue that's been hiding in plain sight. Just like those iconic moustaches sparked conversations about prostate cancer and mental health, I want every conversation about workplace safety to include some specifics about slip prevention. Today I want to share 4 things with you. First, why slip safety matters more than you might think. Second, the shocking reality of what's happening right now in buildings across the country. Third, how my scientific approach called slipology is helping organisations achieve 57% plus reductions in slip incidents. And fourth, what you can actually do about it, starting this Sliptember. Because here's the truth, by the end of this episode, you'll never look at floors the same way again. If I can, please let me tell you why this became my life's work. On May the 13th, 2012, you may remember the date because it was the day Manchester City won their first Premier League title. I was walking to the shops with my then girlfriend, now wife. It was a beautiful sunny afternoon and we'd visited Columbia Road Flower Market in East London. I'd parked my car on our way home in Islington and we were walking towards the Sainsbury's store, but then that was the last thing I remembered for several hours. A car sped around the corner, lost control, mounted the curb, and ploughed straight into me. I suffered a broken collarbone with a metal plate that's still there today, broken wrist, broken ankle, facial injuries, and months of recovery, as well as some neck damage too, now I come to think of it. But more than the physical damage, the accident fundamentally changed how I see the world. You see, I trained as a management consultant before this happened. I was analytical by nature, always looking for problems to solve and systems to improve. But after experiencing firsthand how quickly an accident can shatter your life, literally, um, I became obsessed with prevention. Since then, I've spent over 13 years focusing specifically on slip prevention because the data told me this was where I could make the biggest impact. I've worked with over 4,000 client sites, from hospitals where vulnerable people need to feel secure, to airports handling millions of passengers, swimming pools where floors are designed to be wet, to supermarkets like the one where Stanley May lost his life. My book, Prevent Slip Accidents with Slipology, hit #1 on Amazon in both safety and insurance categories. But the real measure of success isn't book sales, it's the fact that my clients typically see 57% or more reduction in slip incidents. Some have gone entire years without a single reported slip. The difference between my approach and what most people do, while others put out yellow signs and hope for the best, I use science. My mantra is simple. Until you take a scientific approach, you'll never achieve 100% certainty that your slip and fall risks are under control. So let's talk about the size of this problem, because I guarantee it'll surprise you. The latest HSE data shows that 32% of all workplace injuries, that's over 179,000 incidents last year, were slips, trips, and falls. This makes slip accidents the single biggest cause of major injuries at work. Not machinery accidents, not falls from height, slips. But that's just workplace data. When you include public spaces, the numbers become staggering. Every year, slips cause over 300,000 A&E admissions. That's over 800 people every single day needing emergency treatment because they slipped. The result, 1.5 million NHS bed days annually. Chris Whitty, you might remember, actually highlighted this during the COVID press conferences, talking about slip accidents and how they strain our health service every winter. Now, I want you to think about this for a moment. During COVID, we were all acutely aware of hospital capacity. We understood that every bed mattered. Yet here we are, using 1.5 million bed days every year for something that's preventable. From a cost perspective, this gets even more shocking. AXA Insurance, and they're just one insurer, reports that slips cost them £80 million in 2018. That's 2.5 times more than manual handling injuries. And it suggests that across the whole of the UK, we're spending well over £1 billion on claims every single year. Now, I mentioned 2.5 times more than manual handling, yet I doubt I've ever met an organisation that puts 2.5 times more effort into slip prevention than manual handling training. Have you? HSE estimates that 95% of same level falls result in serious injuries, broken bones, or worse. We're talking about a broken bone every 3 minutes in the UK. Let that sink in. While we've been having this conversation, probably 5 or 6 people have suffered serious injuries from slip accidents. But here's what really troubles me. I visit organisations across the country, indeed across the world, and most people genuinely believe they're doing well on slip safety. They proudly show me their yellow signs, their cleaning schedules, their generic risk assessments that have been updated in years. Meanwhile, I'm often looking at floors that have a 1 in 2 slip risk when wet. Now, I'm not here to criticise, I'm here to help. It's great that I've never met an organisation doing zero on slip safety. Everyone is doing the basics. But a key message is that to go from good to great can see a halving of incidents and saving of hundreds of thousands of pounds a year. In other words, exponential improvement, but it doesn't require exponential additional investment. Just last month, I visited a busy train station. The facilities manager was convinced their floors were safe because they'd been installed 5 years ago as slip resistant. When we tested them, we found slip resistance so low it was genuinely dangerous. They'd been cleaned daily for 5 years, but nobody had ever checked if the cleaning was actually maintaining the floor's safety properties or not. There's a mindset I see everywhere that I call the slip problem. People treating slip safety as simple, low cost, impossible to prevent, and paltry. But the reality is quite different. Slips aren't simple, they're subtle. They involve the complex interaction of surface materials, contamination, footwear, human behavior, and environmental factors. They're not low cost. As we've seen, they cost billions, and they're absolutely not impossible to prevent when you know what you're doing. The truth is this: slips are serious, scientific, and 100% stoppable. This is where slipology comes in. It's the methodology I've developed over 13 plus years of working exclusively in this field, refined through thousands of real-world applications. At its heart is the CHIMES framework, 6 interconnected factors that determine whether someone walks safely or slips. Let me walk you through each one, because understanding these could literally save lives. C is for contamination. A clean, dry floor is a safe floor, but here's what most people don't understand. You need to clean for safety, not just for appearance. I've seen floors that look spotless, but are contaminated with invisible residues that make them incredibly slippery. Traditional cleaning often makes floors look good, but leaves behind soap films or polish that actually increases slip risk. Don't assume a floor is free of contamination just because it looks clean. H is for heel, the footwear people wear. There's a massive difference between safety shoes and truly slip-resistant footwear. People are often surprised by that. Most safety boots, for example, pass basic standards, but offer little protection against slips. I've worked with organisations that spent thousands on safety footwear, only to discover it performed poorly in their specific environments. And remember, in public places, don't blame the person wearing high heels. Instead, look in the mirror. You need to risk assess and make your building safe for that person to use when they, quite expectedly and quite fairly, wear those shoes. I is for individual, human factors. When people are rushing, carrying loads, turning corners, or are distracted by their phones, their slip risk increases exponentially. It's not just about blaming people, it's about understanding that human behavior is predictable and we need to design our environments accordingly. So think about this: how can you change your ways of working to reduce slip risk? M is for maintenance. Here's something that shocks people. Your floor's slip resistance changes over time. A floor that was safe when installed might be dangerous now due to wear, ineffective cleaning, or changes in use. Most organisations have no idea what's happening to their floor safety over months and years. Think of the wedding suit analogy. 3 years after your wedding, you might have put on a bit of weight, but it doesn't happen overnight. Changes to slip resistance can happen gradually too, if maintenance isn't done scientifically. E is for environment. One of my favourite business mentors says, environment dictates performance. And I couldn't agree more. Everything from lighting levels to entrance matting affects slip risk. Did you know, for example, that most entrance mats are far too small to be effective? HSE guidance says for 400 people per hour using an entrance, you should have 6 to 7 meters of built-in permanent matting. Most buildings have about 50 centimeters. That's not prevention. That's wishful thinking. And finally, S is for surface, the floor itself. This is where science becomes crucial. Instead of guessing whether a floor is safe, we measure it using the pendulum test, the only method approved by the HSE for slip resistance testing. This gives us a pendulum test value that directly correlates to slip risk. A result of 24 means a 1 in 20 chance of slipping. A reading of 36 means a 1 in a million chance. That's a huge difference in slip risk, but you can only tell if you do the test. Speaking of the test, by the way, stay tuned for your chance to win a free test visit by one of my team worth £595. The power of the slipology approach became clear when I worked with a shopping centre that was averaging 15 slip incidents per month. Using CHIMES, we identified that their main issues weren't the obvious ones. It wasn't just about cleaning frequency or floor type. The real problems were inadequate entrance matting, allowing contamination deep into the building, cleaning products that left residues, and lighting that made it hard to see potential hazards. We addressed each CHIMES factor systematically: better matting systems, improved cleaning protocols with products designed for slip resistance rather than just appearance, lighting upgrades, and targeted anti-slip floor treatments in high-risk areas. The result? They went from 15 incidents per month to 0 incidents for an entire year. Now, I'm a fan of data, you'll have gathered, but for me, this isn't really about statistics or business cases, important as those are. Every time I see a yellow wet floor sign being used as a permanent solution instead of actually fixing the problem, I think about Stanley May. Every time I test a floor and find it's dangerously slippery when it could easily be made safe, I remember how my own accident changed everything in an instant. Over the years, I've met people whose lives were completely altered by slip accidents. Alison Hockday, a former occupational therapist, lost her leg after 2 separate slip incidents. Andreas Wuchner suffered traumatic brain injuries after slipping on Baileys at Heathrow Airport. One of my best friends slipped in a playground when heavily pregnant and then had to be in a wheelchair for months until after the birth. These aren't just statistics, they're real people whose lives were turned upside down. I remember visiting a care home where residents were afraid to leave their rooms because they didn't trust the floors. Just imagine being trapped in a small space, not because you can't walk, but because you can't trust the environment around you. That's not just a safety issue, it's a quality of life issue. I've also watched businesses nearly collapse from single slip incidents. A small restaurant I know faced a £200,000 claim that nearly bankrupted them. All because they didn't understand that their so-called non-slip tiles weren't actually slip resistant when contaminated with the oils from their kitchen. Here's what drives me. Slips haven't got the serious attention they deserve, partly because they seem so ordinary. There's this cultural acceptance that slip accidents are somehow inevitable, just part of life. We laugh at slips in cartoons and movies. Even I'm guilty of that sometimes. We use phrases like slipped up to describe minor mistakes, but that's exactly the mindset we need to change. My goal is ambitious. I want to prevent 500,000 or more slip accidents globally each year. Sounds impossible? Well, it starts with conversations like this one. It starts with people understanding that slip safety isn't about compliance or box ticking. It's about protecting human dignity and preserving families. And here's something I've learned from working with thousands of organizations. When you get safety right, everybody wins. Employees see that their company genuinely cares about their well-being. That transforms workplace culture. There's less downtime from accidents, fewer insurance claims, improved reputation. Customers feel more confident in your premises. Partners prefer working with organizations that demonstrate genuine care. Safety isn't expensive, it's priceless. And done properly, using scientific methods rather than hope, it actually generates profit. As I often say, profit from safety isn't an oxymoron, it's an achievable goal that forward-thinking organizations are already realizing. Well, that's why I do what I do, but what does Sliptember offer you? Throughout this month of September, I'll be sharing the exact tools, techniques, and insights that my paying clients use to transform their slip safety. We're talking about real case studies with names, numbers, and measurable results. Practical measurement techniques you can implement immediately. The specific products and methods that actually work, as opposed to the marketing promises that don't. You'll learn how to conduct your own basic slip risk assessments, how to specify truly effective entrance matting systems, how to evaluate whether your cleaning is helping or hindering your slip safety, and crucially, how to measure your floor's slip resistance scientifically. I'll be sharing daily videos on all the social media platforms, hosting interactive safety roundtables on Zoom with experts, including ROSPA and DECRA, presenting at IOSH, IIRSM, NEBOSH, and APS events, as well as for law firm KIOs to a group of insurance companies. For you, this isn't just about preventing tragedies like Stanley May's death, though preventing even one would, of course, make the entire campaign worthwhile. This is about positioning yourself and your organization as genuine leaders in safety. It's about reducing your insurance premiums through demonstrable risk reduction. It's about improving staff morale by showing you care about their well-being. It's about creating environments where elderly visitors, parents with pushchairs, and people with mobility challenges can move with confidence. Whether you manage one building or 1,000, whether you're in healthcare, retail, hospitality, manufacturing, or education, these principles work. The science doesn't change based on your sector. It applies universally. So, right, here's exactly what I want you to do, and I'm going to make this as easy as possible for you. First, take my slip prevention scorecard at scorecard.slipsafety.co.uk. It takes exactly 3.5 minutes, I've timed it, and gives you an immediate assessment of where your slip safety stands based on CHIMES that I covered earlier. Plus, you get a personalised PDF report, and more importantly, it gives you the chance to book a one-to-one session with me or one of my team to discuss your specific situation and see what can be done to mitigate your slip risks. Secondly, and this is where I really need your help to spread this vital message, share this episode on your social media and tag me. When you do, I'll personally send you a free physical copy of my book, Prevent Slip Accidents with Slipology. But here's the really exciting part. You'll also be entered into a prize draw to win 10 professional slip tests worth £595 each. So there'll be 10 winners drawn at random at the end of the month. That's scientific evidence of how safe, or hopefully not unsafe, your floors really are, conducted by qualified technicians using HSE approved equipment. Third, book into my free 90-minute Slipology workshop, where I'll walk you through the CHIMES framework in more detail, show you real before and after case studies, and answer your specific questions. You can find the registration link at workshop.slipologybook.com. But here's the crucial point. This only works if people engage. Sliptember is a community-driven initiative. The more people share, discuss, and implement these ideas, the bigger impact we can have. Your share could be the catalyst that prevents someone else's Stanley May tragedy. Remember, every person you reach with this message is potentially someone whose accident we prevent. Every organisation that takes action could save multiple injuries. The ripple effect of awareness is enormous. To sum up then, Sliptember doesn't have to be just another month where slip accidents happen to other people in other places. It can be the month you decided to take control and create genuinely safer environments for everyone who matters to you. This isn't about becoming a slip safety expert overnight, though some of you might choose that path. This is about understanding that you have more power than you realise to prevent slip accidents, protect people, and even drive business success through scientific safety management. You can stop slip accidents. Use the science. That's not just my tagline, it's an achievable reality that thousands of organizations are already proving every single day. So do join me for Sliptember. Let's make this month the month we start preventing tragedies instead of just counting them. Because every step we take toward better slip safety is a step towards a world where people like Stanley May get to go home safely to their families. The future of slip safety starts with conversations like this one, and it continues with actions like yours. All the best, and see you next week for another podcast episode.
Thanks for joining us on the Safety and Risk Success podcast. If you've enjoyed this episode, please hit follow and do share on social media. Does anyone you know spring to mind as a great guest, even yourself? If so, please contact us on podcast@slipsafety.co.uk. See you next week for another episode.